If I hadn't had any of the physiotherapy services, I'd have probably been totally confined to a wheelchair.
It's all about the patients, whatever's going to be best for them.
Podiatry, they've absolutely been brilliant.
I still felt that maybe when I'd done all this, maybe I would have a small amount of pain, maybe some of it would go, but it had gone, it went.
Without dietetic support, I think I would have found it extremely difficult to win my battle with anorexia.
I'm not in as much pain as I was before.
I've had a lot of assistance from the occupational therapy department to enable me to be independent and empowered in what I do in daily life.
We work with individuals primarily with neurological conditions, but anyone with a rehabilitation need, to become more independent in what we would call activities of daily living. That's everything from kind of getting up and out of bed and washed and dressed in the morning, to being able to cook meals, go to the supermarket or do your hobbies. The primary benefit for patients accessing our services is maintaining independence. That might be regaining independence after something like a stroke, or it might be maintaining independence in the face of a condition that's deteriorating. So it's kind of keeping you doing as much as you can for as long as you can and helping you do it to the best of your ability.
I'm a full-time wheelchair user because of cerebral palsy, which mainly affects my lower body. There's nothing wrong with me medically. I'm a fit person. I just have to interact with the world slightly differently. When I moved into this house, I had support for making it fit my needs. I wouldn't be able to be the voice of independence, the voice of can-do, unless I had those services behind me. And I've had immense amount of understanding from the occupational therapy, who've been incomparable really. I don't think I could do what I do without the support I've had.
As speech and language therapists, there's two aspects of treatment that we do, and that is speech and communication and swallowing. We would see ENT patients, we'd also see patients with neurological problems such as head injury and stroke. And then we also would see people such as stammerers and then people with physical problems such as cerebral palsy. Often with communication problems people can lose their confidence, so it's quite nice to actually give them that confidence back and achieve their best level of independence.
Physiotherapy is how we treat patients to help to return them to as near normal function as possible. We try and help the patient to achieve their own goals. We can use a variety of techniques, we can use exercises, look at the range of movement, look at the mobility. We can help with pain by using a TENS machine or acupuncture.
A lot of people will relate to sporting injuries, back pain, neck pain, however it's a lot more diverse than that. We work with a wide range of patients across a lot of different settings. We run a mobility clinic and the respiratory clinic as part of our service. The respiratory clinic, for example, provides advice and self-management for people who've got long-term respiratory conditions, and hopefully by doing that we improve their quality of life. Well, our particular service is domiciliary, so it can cover anybody really that is housebound. So neurological patients, for example, people who've had strokes, multiple sclerosis, Parkinson's.
I was born with cerebral palsy. I developed epilepsy after that. More recently, I've broke a hip.
Hi Philip, it's Joan.
And a couple of years ago, I broke my back, and my health just seems to deteriorate as the older I get. The physios have been the best therapist service that I've had, especially the home visits. It's more convenient because you're in your own home. You feel more relaxed because you're in your own home as opposed to a hospital setting. It's very important for me not to be confined to a wheelchair 24/7. Well, the longer I'm independent, then the more time I can spend here in the bungalow, and the more time I'll have with my friends that I've made around here.
As podiatrists, we treat a whole range of foot problems, from the more complex problems suffered by diabetes, such as foot ulcerations, rheumatoid arthritic problems, to the end of the scale that the man in the street will be aware of, such as corns and callus. We deal with a whole age range of patients. People can access our service simply by going to the GP, who can then fill in a referral form. We do link in with other disciplines such as physiotherapy. They are also able to refer patients to us. It's a great feeling when you get someone limping into your room. You spend half an hour, 45 minutes with them, and that patient leaves with a smile on their face and they're comfortable.
I've had a muscle complaint now since the early 70s. I have a lot of pain. Walking's a great difficulty, like 20, 30 metres is about it, like, you know, I have to sit down and rest. So I've needed constant treatment. Podiatry, they've absolutely been brilliant and kept me mobile. They'll do all for you. I think if it didn't have been for podiatry, I'd have been in a wheelchair now, definite.
There is a misconception that dietetics is just about weight management, obesity, but dietetics is about translating the science of nutrition into practical advice about food and helping someone to understand that and put it into practice in their life. We see children and adults. Dietitians are the only health professionals in the NHS to have a qualification in nutrition. We are in tune with what people eat and drink in Barnsley. The impact of dietary advice is that it can have a knock-on effect to other aspects of health and quality of life. So we know that by eating a healthier diet, that can influence our blood pressure, it can influence our weight, it can influence our energy levels, which can mean that a person feels better.
I developed an eating disorder when I was 13. It first began as bulimia, and as a 13-year-old it's just a very scary thing to be going through. From bulimia I turned anorexic, and I felt minute by minute my life was being destroyed by this illness and there was nothing that I could do. My eating disorder was chaotic, problematic. Last year my BMI dropped below 15, which is extremely dangerous. After 18 years of living with an eating disorder, I needed to take control. Without dietetic support, I think I would have found it extremely difficult to win my battle with anorexia. I can now have a picnic with my little girl. My dietitian was extremely patient from the beginning. Without her, I wouldn't be sat here filming this today.